coming off the street. I'm just using this example.
I understand what you're saying.
I'm coming off the street and I'm saying people come here for 4 reasons. I'm reading 2 important ones because I'm thinking I've got a disease and I want to know how to prevent that disease down the line. I'm just assuming that you could help me from some other...
The vast majority of people that come to chiropractors come for just that reason. They have a condition... Let me finish, please. They have a condition which has failed consistently over 10, 15, 20, or 30 years to respond to medical treatment. Any condition.
Give me one, please.
It really doesn't matter.
Give a condition.
Asthma.
Okay.
Okay? Allergies, menstrual cramps, arthritis, conditions which have failed to respond to medicine consistently over the years.
Asthma.
Yeah, let's point out that 7 out of 10 Americans over age 40 are suffering from a chronic disease of some kind, which fails to respond to the administrations of medicine. It's all well and good for our doctor to sit here and say he doesn't believe there's any scientific validity. What background he would have, he admits he knows nothing about chiropractic, but he's already made a decision it's not valid. If medicine worked, nobody would ever go to a chiropractor in the first place. All of these people you're talking about come to chiropractors because they're medical rejects, and they say, Doctor of Chiropractic, can you help this disease, that disease, the other disease?
Tell me about asthma.
Can you cure asthma?
Tell me about asthma.
Or, all right, let me finish. Whether it's asthma, whether it's arthritis, menstrual cramps, any of these conditions, patients do go to chiropractors to have those diseases treated. But the chiropractor teaches them that we don't treat disease.
Okay, tell me about asthma.
I have told you about asthma. We do not treat asthma. We do not cure asthma. If I've got asthma, what are you going to do for me if you don't cure it?
I'm
going to do nothing for your asthma, but I'm going to
Or are you going to play with this, my spine?
I hope not. If you want it played with, go to a massage parlor. If that's what turns you on, that's your thing.
I love it.
Okay. You come to me, I will do a specific chiropractic analysis of your spine to see if there is a subluxation damaging nerves. If there is, without regard to whether it causes asthma or not, or any other disease or not, I will gently ease that bone back into place, restore normal nerve function.
Okay, will that easing it back into place, restoring a normal nerve function, would that help
it
my
will
asthma?
Help your body to function normally.
So maybe now, eventually it might help my asthma.
Let me finish. Tens of thousands of patients every year, once nerve supply is restored, of course recover from asthma. There is no condition you can name which the body itself cannot cure. Chiropractors don't cure anything. All of chiropractic is based upon a recognition that there is built into the human body the ability to recover from disease, whether it's the common cold or asthma or any other disease. But let me finish, please. Okay. What is called spontaneous remission, self-cure, it happens with chiropractors or without, with medical doctors or without, with acupuncturists or without. The body has the ability to heal, but the healing ability of the body is lessened, is damaged when some of the vital nerve trunks are pinched off.
Okay, Reggie.
The body then has a better chance to function if there are no nerves.
Occasionally I'm going to interrupt you very professionally. It's nothing personal. But let me say this. You use the word cure as I was taught what cure was, okay, from Webster or Funkenwagen or whatever dictionary you have. By going this way or that way, you're doing something to me. What are you doing? You're treating me, right?
Not really.
But, you're doing something to change my regular structure.
Yes.
Are you not?
Yes.
So that's a treatment.
What I'm doing is trying to allow your irregular structure to become regular.
But that's a treatment. That is a treatment.
No, treatment, by definition, you're into dictionaries. Treatment is what one does to counteract a disease. You treat a cold. You treat asthma. I don't treat a cold. But if you came to me, I wouldn't need to know if you had a cold or asthma or neither one.
Well, what the hell am I coming to you for?
You're coming because you're mistaken about chiropractic. And when you get there, I sit you down and say, Gentry, if you want that disease treated, you're in the wrong place. I don't do that.
But what about those thousands of people who have the asthma, and they're coming to you no matter what you sit down and talk to them?
What about those people? And I sit down and I explain to them, we do not treat asthma. People do come for that reason. It's
but they may want it anyway, right? They may
if they want their disease treated, they have to go and see one of these fine doctors or one of their colleagues who treat asthma.
You don't treat anything.
That is correct.
By turning the spine, messing around with this, there's no such thing as a treatment, right?
Well, again, you'll forgive my correcting your language. The spine is already messed around. We're unmessing it.
Okay.
All right? We're allowing normal nerve function.
And that's not a treatment?
No, it absolutely is not a treatment. However, once nerve supply is normal, if every organ is functioning properly, of course the body has the ability to recover. Who do you think cures your colds? Your medications?
Yes.
Absolutely not.
My opinion, it does.
Well, you're absolutely wrong.
Well, as long as it makes me well.
Would you accept the...
That's an intern, it's over
Would
there.
you accept the opinion of the two learned medical doctors on cures for a cold?
I wouldn't want to change it. I would like to think that the medicine is curing my cold.
They will tell you...
I don't think they want to go out of business.
Believe me, they will tell you the only cure for a cold is your own body recovering from within. Healing takes place from within the body. Doctors don't cure things.
Before we go to our break, I want to ask, doctors don't cure things.
Of course not. They try and keep you alive long enough for your body to heal itself.
Doctor Grant, you don't cure things?
Well, I would agree with the cold.
But what about other things?
I think that there are a few conditions which we can say we can cure. For instance, pernicious anemia can be cured with monthly injections of B12. Insofar as by cure you mean something that you are doing that restores...
Asthma, heart disease, some type of heart disease or asthma or something of this nature.
You can certainly help many kinds of heart disease. You can help help asthma. When you get into real cures, by meaning permanent cures, that gets a little trickier.
Sure does.
What about corrections, surgical corrections, Dr. Williams? Does that help the cure, or eventually can a person get cured by some type of surgical correction?
Oh, yeah. In surgery, you often remove the focus of disease, and that does produce a cure. There's no doubt about that whatsoever.
That's true. If you have a bad arm and you cut it off, you don't have a bad arm anymore.
Yeah, my impression, though, is that I've done some industrial work, and the people who go to chiropractors go to them because they feel that they're bone doctors and they can help their aches and pains and things of that type. I'm here to learn as well as the public. I'd like to ask Dr. Romberg, what type of machines and so forth, auxiliary things, do you use other than manipulation with the hands?
Well, there's two things I'd like to respond to. The first is that we do know manipulation. Manipulation is something other than what chiropractors are trained in doing. I think osteopaths learn to manipulate. Chiropractors give very specific spinal adjustments to remove the subluxations. And the other point that you mentioned about the machines, this physical therapy and this sort of thing, is really not part of chiropractic at all. We have no use for anything like that in our office. In fact, we believe that the physical therapists should be the ones to administer physical therapy and not the chiropractors who are not properly trained in it.
Good evening. Phone par, your question or comment? You're on the air.
Well, I just wanted to know what could be an alternative for me to go with now, you know, because I really don't know where to turn. You know, he's just given me this information that I have a spinal curvature and that it could become worse, you know, and I don't really know what to do. Should I get a second opinion or?
Okay, would you hold on a minute, Dr. Williams?
If I were in this young lady's position, I would go to see an orthopedic surgeon. If she has a curvature of the spine, then certainly that is the individual qualified to treat her condition.
Any symptoms that would suggest anything that would lead to paralysis, curvature of the spine. Many people have curvature of the spine. Sometimes they produce symptoms, sometimes they don't. If they're producing symptoms, then I would see an orthopedic surgeon.
Yeah, except if we go with an orthopedic surgeon, we get into more scare tactics, and the thing that scares the dickens out of me is spinal surgery. So I just don't know what's going on in this case. It's very difficult to suggest by this telephone information. It might be a very good idea to consult another chiropractor. We're automatically assuming that if this chiropractor is not giving good information, and I don't even know if he is or not, but if he's not, it may be an idea to consult another chiropractor rather than rush to surgery.
So you're saying consult another chiropractor, and he's saying consult another, not a chiropractor, but
an orthopedic surgeon.
Orthopedic surgeon, yes. And you...
Well, orthopedic surgeons don't necessarily just operate.
Okay.
More than half their work, considerably more than half their work, does not involve surgery.
That's true, but on the spine, there is no way that an orthopedic surgeon can correct a subluxation of the spine. They will attempt to through surgery or through back braces, which don't correct anything. And I really think if this were me in this position, the first thing I would do is seek another chiropractic opinion. And I'd stay away from the orthopedic surgeons for something which is in fact not a disease. Curvature of the spine in and of itself is not a serious or dangerous thing, and this language of paralysis, inability to walk, sounds as though it's coming just as a threat and not related to anything that's happening in the woman's spine. It bothers me considerably.
Great.
That subluxation of the spine. Now, you say the orthopedic surgeon can't do anything about it, but you can. Now, that is where the chiropractic and the medical men differ. The subluxation, we feel that any pressure put on the spine, on the nerve, actually produces damage to the tissue itself, but it's readily recognizable by a certain location of that spinous process.
Well, you say
now,
that in one breath.
Can you tell me what subluxation that you're describing is that produces pressure on a nerve and yet produces no actual symptoms?
Oh, you have just described it. You have just described it yourself. In one breath, you're saying we recognize it and we can certainly get rid of it, or orthopedic surgeons can. And a little while earlier, you said there's no validity to the practice of chiropractic, which is what you are now claiming orthopedic surgeons are doing. You see, when chiropractors started doing this, orthopedic surgeons were the ones who said there's no validity, there's no such thing as a misalignment of the bone damaging nerves. Now they're attempting to do that, which a few years ago they said couldn't happen. There's a whole new branch of orthopedic medicine now trying to imitate what the chiropractor does, a branch called physiatry. And they manipulate the spine to correct these subluxations. They're not very good at it. It's a part-time job for them. They're not full-time professionals at it. But that's what chiropractic is.
You still haven't described a subluxation.
Oh,
What
I will.
is a subluxation?
Okay. A subluxation is a condition in which one of these vertebrae loses its proper relationships with the vertebrae above and the vertebrae below. A slight misplacement, misalignment of a vertebra, which does make the hole between the vertebrae just a tiny bit smaller and irritates the nerves. Now, if we have a sensory nerve damaged or irritated, we might get immediate pain, immediate muscle spasm, the so-called pinched nerve syndrome. On the other hand, it might well be a motor nerve that is damaged, or a trophic nerve, in which case the organ at the other end of that nerve may show no symptoms at all for 10, 20, or 30 years. But that subluxation should be corrected whether it has symptoms or not. We see a lot of football injuries where players get a pinched nerve in the neck, damaging nerve supply to the arm, and the arm is partially paralyzed, and everybody says that's terrible because it stops the game. But meantime, if they have the same injury that damages the nerve supply to the heart or the lungs or some other vital organ, we can't see any symptoms, and so we ignore it. Chiropractic says, let's correct all subluxations of the spine, whether they show symptoms or not. So that's our field.
And everybody that comes in has a subluxation of the spine, so you would treat everybody in the world,
Not
really?
necessarily. No, not everybody has one. But when there is one, it should be corrected. I would like to see chiropractors practice on a preventive basis to maintain health. Let's say you come into me and I examine your spine and I do find one of these subluxations. Now, I don't just adjust it and say, okay, that's the end of the problem. I say, go on home and let me check you next week. Next week you come back and your spine is still clear. I say, good, now go away for a month. And if you come back after a month and that subluxation is back again, I will adjust it again. Unfortunately, when people leave the chiropractor, usually they go back and do the very thing which caused the subluxation in the first place. So it does tend to come back again and again, and it needs correcting periodically. But no, not everybody has a subluxation. And the chiropractor can only help those that do.
Okay, let's take another phone call at 367-7211. Good evening, phone power. Your question or comment, you're on the air.
Yes, thank you.
Go ahead, please. Go ahead, please.
Yes, yes. My question is, my statement is directed to Dr. Terry Runberg.
Yes.
And I was in an accident with my daughter about 2 months ago, and I went to a regular MD, and I had an X-ray taken, and nothing really showed up. So I went to work about 2 days later, and my back hurt me so bad I had to sit down. So finally I went home. So I went with my daughter over to Dr. Terry Rodenberg, where his associate, Dr. Charles Wallace, worked under the back of my neck and my nerves, and I've been going there ever since for the last 2 months. And my back has just been wonderful.
Okay, what was the question to him?
Pardon me?
You had a question. What was the question?
Oh, I know, but just a statement.
Okay, thank you. Let's discourage testimonials on, I don't care, on a little bit of everybody, whether it's one way or the other. I think we really want to deal with questions and answers.